So my name is Debra Kaysen. I'm going to be presenting for both myself and Shannon Wilsty-Sturman. And I will be talking about a project that we've been working on called Pause a Moment. This project was funded by donors as the COVID-19 pandemic unfolded. And the concept behind this was that we needed to find something that would be relatively low cost and scalable that could meet the mental health needs of healthcare workers. So just to contextualize this briefly, this is based on some research done by Rebecca Hendrickson. When we look at the impact of COVID-19 on healthcare worker mental health, what we're seeing is that about a third are showing symptoms of PTSD. The rates in the data around depression and anxiety range quite a bit when you look across contexts, but in her sample, she's seeing that 75% are above a clinical threshold for depression and anxiety symptoms, about a third are having trouble with insomnia, and a little over 10% are having levels of suicidal ideation. So one of the challenges in reaching out to healthcare workers is they often have long shifts. They have competing demands on their time, and generally they tend not to prioritize their own mental health. In addition, seeking treatment for mental health concerns is generally stigmatized and can have professional consequences in some states. So there are a number of reasons why people may not reach out to traditional mental health programs. Based on that, what Shannon and I wanted to do was to come up with an intervention that would be tailored to their symptoms and the response to an intervention. This is just an example of the process that we developed. So we offer people an option to either enter the program based on what their mood is in the moment, and then they're encouraged to do an initial assessment, which dictates the pathing for suggestions for interventions for them. So for example, this is the trauma pathway. If they're above a clinical cutoff for PTSD, they're presented with a mix of tools, and we selected based on feedback from end users that there would be sort of two sets of options. There would be quick tools and specialized tools based on their time in the moment. The tools were selected based on the existing clinical evidence about what might be effective for that particular pathway. So for example, for the trauma pathway, we have cognitive restructuring, we have behavioral activation, and then we have another cognitive restructuring tool that's specifically targeting hindsight bias. Now, these are just the first tools that people are offered. There are other tools as well if they don't respond to these. They're then encouraged starting at week 3 to reassess symptoms. And if they have improved more than 20% on the assessment, they're randomized to either get encouragement to stick with what they're doing or to try something new. And this is because there wasn't data to say whether people would be better off based on response or non-response. We do this a similar thing if they have not improved, to get a higher dose of an existing intervention or to switch to a different type of tool. Just to show you a little bit about the user interface. So this is the welcome back page. It encourages me to complete my reassessment and to check my progress to date. This is also if somebody is not willing to do the assessments or it's not a time for a reassessment, it asks what my feelings are in the moment, what's my level of distress, which we use to check whether a tool is working in the moment or not and give feedback on that. And then we do ask about whether there's been trauma exposure. This is the progress page for users so they can see what tools seem to be effective for them and what tools seem to be less effective. And just to show you a little bit about what this looks like in terms of tools, this is the cognitive restructuring tool. This has examples for multiple different kinds of concerns, including for people who are not reporting current mental health symptoms. The types of tools generally that the program has includes cognitive restructuring, behavioral activation, mindfulness, and problem solving, among others. And we selected things that had some evidence base for effectiveness for the target complaint. And what you can see is that although this is targeted towards healthcare workers, the examples were chosen where this could also be used with other potential populations. So the person is given a general example and then is given space to work through a cognitive restructuring exercise on her own. They're able to store their worksheets and pull them back up whenever they prefer. So this just gives you a little bit of a taste of where we are right now with Pause a Moment. It is actually not part of a research trial based on the donor wishes. This is actually soon to go into the field. Thank you.